Diarrhea has a stop button. Loperamide, sold as Imodium and store brand equivalents at 2 mg per tablet, is a peripherally acting mu opioid receptor agonist. It slows intestinal motility. At normal doses, it does not cross the blood-brain barrier, so it does not sedate or produce euphoria. That is the reason you can buy it off a Walgreens shelf next to the antacids. The standard over-the-counter dose is 4 mg to start, then 2 mg after each loose stool. Cap yourself at 8 mg per day for self-treatment. A 24-count box sits in the low single dollars at Walgreens. You want it in your kit alongside the oral rehydration salts. The two work together. Here is the clinical rule in 18. Delta learns cold. Loperamide is a tool for watery, non-inflammatory diarrhea. It is contraindicated in 3 situations: high fever, bloody stool, suspected invasive bacterial infection, or Clostridioides difficile colitis. In those cases, slowing motility traps the pathogen in your gut. The infection gets worse. That is the mistake civilians make when they reach for Imodium during dysentery. The drug helps the wrong kind of diarrhea and hurts the right kind. Civilian approach versus trained approach. The civilian sees loose stool, pops 2 Imodium, and moves on with their day. The trained approach asks 3 questions first. Is there blood? Is there a high fever? Is the patient looking systemically sick? If the answer to any of those is yes, you don't stop the motility. You push fluids, you stabilize, and you get the patient to a clinician. In 2016, the Food and Drug Administration issued a formal drug safety communication about loperamide. High doses, largely in the setting of abuse for opioid effects, are associated with serious cardiac events. Specifically, prolongation of the QT interval, torsades de pointe, and cardiac arrest. The other thing loperamide is not is a rehydration drug. It slows down the plumbing. It doesn't replace what has already been lost. So you pair it with the oral rehydration sachet from item 1. Loperamide buys you time. Oral rehydration keeps the patient alive during that time. Use them together, or you get half the value of each. The multifunction pattern is straightforward. Traveler's diarrhea, norovirus in a family group, long car evacuation with a sick child, grid-down setting with limited toilet access. All of these are the correct use case. Bloody stool with fever needs evaluation, not an anti-motility drug.